Usually every morning our doctors require a wean-in assessment on our vein patients to see if they're eligible for extubation. So this is our spontaneous mode. The patient's going to basically do everything on their own. So you'll have your flow trigger like we talked about earlier, usually 2 to 2.5. Your oxygen, we extubate on 40 liters, or
40%, yeah.
40% for the here. And then for your pressure support, you'll have it on 5 or 6. It depends on what hospital you're at. So you'll do 6 over 6. And your PEEP is going to be 6, and your pressure support will be 6. So if your patient can't keep up with this, you will have a backup in case something happens, so it'll swap over for your patient. So you'll set your rate for what you need on your backup. We got 15 on this one. Your pressure control, you can do 15 if that's what they were on before you swap them over. And then you have your TI for your ID ratio for a 1 to 2 normal ID ratio. So we'll confirm. And we'll read for them. So we have our normal ID ratio, 1 to 2. So if I know my patient's breathing 37 times a minute, I know we're done. Wait, we have to swap them back over because they failed their weaning trial. If they're not getting, if you keep on getting your low minute ventilation or your apnea, you know it's time to swap your patient back over, that they're not ready to be extubated for that day. And then you always want to make sure your heart rate, your respiratory rate, your blood pressure, everything is good on your side before you say, hey, let's extubate.
And RSBI.
Yeah. And for your RSBI, you want to make sure that's less than 100 before you extubate. So I'm at 145, so I know this patient is not ready.
We're good?